Hello, this is Dr. Do again. This video is still on alphabetic list problems. Has been lingered in the letter S for so long time. I think I'm going to move on to letter T. The first thing came to my mind is the tachycardia. Because it is so common and it could be minor, could be life-threatening. And also, tachycardia is a form of arrhythmia. So if you recall, I had a previous video on arrhythmia, and I briefly talked about the tachycardia, but today I'm going to probably spend the whole video talk about the tachycardia in terms of the causes and also the mechanism and what kind of tachycardia really need to address by a physician, or particularly those life-threatening situations. So first of all, let me just bring up the emergency situation associated with this tachycardia. Are there any tachycardia really warrant an emergency situation? Of course, there are many. What kind of signs? Tachycardia definition is heart rate for adult. Heart rate more than 100 times per minute. So if that's the case, that's the tachycardia. What kind of tachycardia you need to see the physician right away to the emergency? So the tachycardia occur particularly in older people, with or without pre-existing medical conditions, and associated with feel almost blackout, difficulty breathing, shortness of breath, or chest pain, or fever really high, cannot be brought down by any medication. So these are all the tachycardias, the causes. I think it's really urgent. You need to see a physician. I'm talking about particularly for those older people with or without pre-existing or comorbidities or medical problems. For those who had medical problems before, of course it's older people, if the tachycardia, particularly the heart rate is really fast, you even cannot count them, irregularly, some of the strong, some of the not strong, feel like the heart is thrilling, shivering, that's definitely is the emergency. So this is the emergency situation. Is there any tachycardia that you can manage at home? Actually, we do it probably all the time. First of all, for example, depends on the cause of tachycardia. For the young people without any medical problem, under stress, without enough hydration, from lying down to the sitting up, you feel like a blackout, your heart beat faster, and you drink some water, or just going away. So this is the typical tachycardia that you manage at home. So this is about the one of the most common cause of tachycardia in the young, healthy adult or older children, or young adult or middle-aged adult without any medical condition, without any heart disease. One of the most common causes is the dehydration, or probably just not drink enough fluid, cause the status hypotensive. If that's the case, you definitely you do it all the time, probably manage at home, either through rest or drink some fluid. It's corrected. So what are the mechanism for this tachycardia? Let me just bring this. So usually the heart, when we talk about the heart rhythm, start from the sinus node, which is the pacemaker of the heart, to regulate the heart rate, to tell the heart to send the information through the conductive system to the ventricles, atrial, and to the muscles through the nerve conduction. Said, this is the rate I said. You need to contract, dilate, follow this rate. So this is where is this sinus located? It's located at the right atrium. So that's how the heart rhythm is maintained for normal condition. So having said that, there's so many conditions can disrupt this rhythm. Either the sinus itself had a problem, like the sick sinus syndrome, it's because of the ischemia for the right atrium, then affect this sinus. So that's definitely is one. And also, regardless what kind of anywhere along the conducting pathway, from sinus to the junction, to the bundles, to the branches, anywhere during this passing conduction pathway had a problem, interrupted, or the conduction fall out of the regular circle. So that also can cause arrhythmia or cause tachycardia, or any muscles or just the ventricle or atrium had problems also can have this tachycardia. So based on this is the fundamental mechanism, and depends on the origin of the tachycardia, either the supraventricular, the junction or sinus tachycardia, or the ventricle cause the tachycardia. So these are the, in terms of location, can through this different mechanism to cause this tachycardia. The worst scenario, the most dangerous tachycardia is the ventricular caused tachycardia. That's probably, you already heard about VTach or VFib. That means the ventricle just shaving by itself, completely dissociated from the sinus rhythm. So the sinus, for example, give the signal, but the ventricle said, I'll do my thing, you do your thing. So just shaving there. There's no blood pump out. That's the most dangerous tachycardia. If that's the case, definitely indicating, particularly for older people, indicating you have ischemia. Just go to the emergency without any hesitation. Just go. But usually this has to be diagnosed by the EKG. You cannot tell whether it's ventricular or atrial or sinus. But regardless, for older people, if with or without a medical problem, if you feel like your heart beats really fast, do not hesitate. Go to the emergency. The sooner the better, because a lot of heart conditions like cardiac ischemia or the malfunction that start from just the chest pain, and also chest pain might be subtle, but the arrhythmia also indicating the subtle ischemia. So go emergency. For the young people, I already mentioned, those are the one of the most common cause. And some of the medications for those middle-aged, the older people, medications can cause this tachycardia. I'm sure your physician might indicate when you took the prescription. Your physician might tell you, if you have this heart rate increase, come to see me, or we'll talk about it, or do something else, or cease the medication. For the young people, healthy, which causes, you do not know you have diseases. For example, hypothyroidism. A lot of hypothyroidism probably started some with the heart, just increase the heart rate without any, probably you did not notice it increase your food intake, and heart rate increase, sweating a lot, and losing weight. So if that's the case for the young, middle-aged or young age, man or woman, if you have this kind of condition, see your doctor. Probably there's a hidden thyroid problem, because the thyroid hormone increases the metabolic rate to cause this tachycardia. So this is about the breakdown to the ages, and for the older people, many cause of this tachycardia with or without systemic disease. I already mentioned, from simple just the dehydration, stress, or infection, subtle infection, fever can also cause this tachycardia. So this is a variety of the causes of tachycardia. The danger sign I mentioned, for those people, for those older people, see an emergency, regardless whether you have or do not have pre-existing conditions. If the tachycardia just lasting for a long time, just do without hesitation, see your physician. The sooner the better. For the young people, like I mentioned, if you can manage by yourself, or just take rest or drink some fluid, or see your physician to discover some hidden diseases. So I'm going to stop here, and the video is longer than I thought. But thank you for watching, and I hope it helps, and see you next time.